Welcome back. Welcome back to Kelechi NCLEX review class. Today we're going to be discussing on diabetes insipidus and your SIADH. That is your syndrome of inappropriate antidiuretic hormone. Okay, these two conditions are problem of your ADH. That is the antidiuretic hormone. The antidiuretic hormone is being produced by the posterior part of the pituitary gland, the hypothalamus. So how do you have problem of diabetes insipidus or SIADH? When there is a problem to the posterior part of the pituitary gland, such as it could be trauma, injury, malignancies, or idiopathic, or stroke, surgery. Yeah, some surgeries could cause it, even when the tubules fail to reabsorb water, all this could cause some imbalances with your antidiuretic hormone. So now on diabetes, focusing on diabetes insipidus, in NCLEX you have to know your assessment of a patient. With your assessment on a patient with that particular condition, that helps you to answer your selected and applied questions. That is where you pick, like with this assessment, this can happen to a patient, this can be seen in a patient with diabetes insipidus. That could help you to know the right answers to click to answer your selected and applied questions. So watch out for your assessment when you are answering selected and applied questions. So now what do you see? What do you see in a patient and know that yes, this patient has diabetes insipidus? Your signs and symptoms are, that there is excessive production of dilute urine, sorry. So when the patient is like diuresing, your patient is peeing a lot. What do you see? If a patient is losing a lot of fluid, of course there is going to be dehydration. So when your patient, once you figure out this patient is going to have dehydration, what comes to your mind next is what you're going to see. What are other symptoms that follow up with your dehydration? You're going to be seeing dry mucous membrane, you're going to be seeing pus contigo and dry skin. Okay, and if you're writing NCLEX and you don't know the normal specific gravity, like right now the specific gravity is 1.0102 to 1.025. Please know it because probably this is most common in NCLEX questions. You could see it, and also know your lab values. So what are the symptoms you see in diabetes insipidus? Like I said, dehydration because you are losing excessive fluid from your dilutional urine, and then you're going to see fatigue. Yeah, there will be fatigue, there is headache, there is muscle pain, the heart rate is going to go up. That is your tachycardia, so you watch out for it. And there is inability to concentrate urine. So what's going to be my interventions? Like if a patient is having all this, your patient is having fluid problem. Actually, once you hear of fluid problem, weight monitoring should be the next thing on your mind, because the interventions on patients with diabetes insipidus is going to be watch out for your weight. So how do we watch out for weight? How do we monitor weight? You monitor your weight, same patient, of course we all know same patient, same scale, same time, and same clothes. That is how you get the accurate measurement of your weight. Watch out, this could be a question too, how you measure weight on your patient. And you tell then your intake and output. This is where teaching comes in. You're gonna teach your aide, the certified nurse assistant, that this patient is on strict intake and output monitoring. This is where you have to give the patient a measuring cup to measure whatever the patient takes in, and also measure your output. Don't just discard it. Yes. So we're gonna avoid food and liquids that could cause the patient to diurese. Example, coffee. Coffee have caffeine. So coffee is a diuretic. Do not allow the patient to take coffee, because this patient is already having problem of diuresing, passing excessive fluid. So when you give hot liquids like coffee, that is a diuretic, the patient is going to lose more fluid. So avoid that in your questions. Okay. Now this patient, When a patient is also losing a lot of fluid, what do? Of course, you're gonna administer adequate fluid. Adequate fluid like your hypotonic fluid. So the patient could get IV. So what do you do when the patient is having your IV? Monitor the patient for excess fluid too. Okay, yeah, in severe cases of diabetes insipidus, most doctors can administer desmopressin acetate. Desmopressin can be administered orally, intranasally, sublingually, just many forms. Just watch out for that too, and patients have to wear medic alert bracelet. This is all you need to know for your diabetes insipidus. Okay, let's go to SIADH. That is your syndrome of inappropriate antidiuretic hormone. And your SIADH is when there is hyper secretion of antidiuretic hormone, your ADH. Like I said, diabetes insipidus is low and SIADH is high, hyper secretion of your antidiuretic hormone. So when there is, this could also cause, due to hypersecretion of ADH, that's going to lead to loss of, okay, the patient is going to be retaining a lot of fluid in SIADH, which is going to cause to hyponatremia. Your sodium values are going to be low. What is the normal sodium? Your normal sodium is 135 to 145. Watch out. You could see this in your question. Okay, yeah, because of excess fluid, you're going to be seeing fluid overload in the patient. And also, yeah, patient could also, cerebral edema, the patient, cerebral edema could cause it. And when a patient has hyponatremia plus cerebral edema, watch out for your seizure. This is where your seizure precautions come in. What do you do for seizure precautions? If a patient is at risk for seizure, watch out. Make sure that the side rails are up. Are you going to put all the side rails? No, that is restraint. So you're going to put like 2-3 side rails. Just all the side rails do not have to be up in your seizure precautions. Make sure patients are not on tight clothes and the bed is lowered. Okay. Yeah, this patient is going to have weight gain. That's it. I always say, whenever you hear ADH problem, because it's a fluid issue, let your intake and output and weight gain be the next thing to come to your mind for your selector that apply question. So here, patient is going to gain weight because patient is retaining fluid, but there is no edema. So because of that, you're going to be monitor patient weight. Okay, yes, there is hypertension and tachycardia, increased heart rate. Patient could also be anorexic, loss of appetite. Patient could have nausea, vomiting, and there could also, in SIADH, there is low urine output, while in diabetes insipidus, patient is diuresing, passing a lot of dilutional urine. But in SIADH, there is low urine output, concentrated urine. So what's going to be my interventions on a patient with SIADH? Monitor your vital signs. Remember, this patient is at risk for hypertension. So your blood pressure, you should know your patient blood pressure. This patient is at risk, the heart rate is up. The patient is tachycardic. Even the patient should be on cardiac monitor. Your telemetry comes in here, and your neuro assessment, because remember, because of the cerebral edema, which the patient is at risk for seizure. So you take your seizure precautions, like I said previously. Avoid dizziness. So how do you avoid dizziness on this patient? And the orthostatic hypotension. When you have to ask, this is where health education comes in. You talk to the patient and also your aide. If you're transferring this patient, hey, my patient is at risk for dizziness and orthostatic hypotension due to his condition. So you have to gradually elevate the patient from a lying position. You can sit him up and then transfer him to the wheelchair to avoid dizziness and orthostatic hypotension. Okay. In a patient with SIADH, a patient who is retaining fluid, you can administer hypertonic fluid such as your normal saline. Remember, when a patient is on fluid, you have to also monitor your IMO and also make sure that the patient do not have a fluid overload. Okay, yeah, in cases, most times, doctors also can prescribe vasopressin antagonists may be ordered to decrease the renal response to ADH. So this is your diabetes insipidus and SIADH. So you need to know your content. When you know your content, it helps you to answer select or apply questions. So this is gonna be it for diabetes insipidus and SIADH. Thank you guys. I love you guys. Please do not forget to subscribe to my channel. Bye.